Burning chest pain on Wegovy or Zepbound feels dangerous, but most cases are not heart damage. They are reflux driven by slower stomach emptying, more pressure, and acid moving upward. That is why the burn usually follows meals or body position, not random injury. If you miss that mechanism, you keep treating the sensation while recreating the trigger. The burn often appears after eating. It gets worse when you bend over or lie down too soon. That timing is the first clue. This is usually a stomach pattern, not a heart pattern. Wegovy and Zepbound do not change what heartburn feels like. They change the conditions that make it easier to happen. That is the part most people miss. People then make the same mistake in opposite directions. They panic and stop the drug, or they dismiss the burn and repeat the trigger. Both reactions miss the key question. What pattern is producing the symptom? I am Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. If the burning follows meal size, speed, or lying down, that already tells you a lot. If changing those factors reduces it, that tells you even more. The symptom may feel dramatic, but the logic is often readable. Heartburn here is usually reflux. That means stomach contents move upward into the esophagus, the tube connecting your mouth to your stomach. The burning comes from acid in the wrong place, not from the drug directly burning tissue. Wegovy, Semaglutide, and Zepbound, Tirzepatide, slow stomach emptying. Food stays in the stomach longer, pressure builds more easily, and acid has a better chance of moving upward. Pressure is one side of the problem. Between the stomach and the esophagus sits a muscle ring. It acts like a one-way gate, keeping stomach contents from moving upward. If pressure rises enough, or that gate relaxes at the wrong time, reflux becomes more likely. The drug is not usually attacking your esophagus. It changes digestion. That change raises pressure and makes reflux easier when the surrounding conditions are wrong. That is why the burn can feel alarming without the drug actually causing damage. Now look at the pattern. Did it happen after a large meal? Did it happen after eating too fast? Did it happen after lying down within an hour or two? Those clues matter more than the intensity of the word heartburn. Large meals stretch the stomach. Fast eating lets you overshoot fullness before your body catches up. Lying down removes gravity from the equation. Put that together with slower digestion, and reflux becomes much easier to trigger. When the burn tracks with meals, speed, or lying down, reflux is the more likely explanation. That does not mean every case is harmless. It means the pattern is usually the right place to start. Sometimes the medication is not creating the whole problem. It is acting more like a magnifying glass. It reveals which digestive habits and weak points were already there. Many people had mild reflux tendencies before starting. They just did not notice them enough to care. Then digestion slows, pressure rises, and the system becomes less forgiving. What used to stay quiet becomes obvious. That changes the decision process. If you blame the drug alone, you miss the real driver. The real driver is the interaction between the drug and your habits. That is where the fix begins. Not every episode means the same thing. What matters is when it happens, how often it happens, and what reliably triggers it. One episode after a large meal may not mean much. Repeated episodes after smaller meals are more meaningful. That suggests something beyond meal size is driving the symptom. Portion size matters. Eating speed matters. Meal timing and body position after eating matter too. These are not vague lifestyle tips. They directly change pressure inside the system. Smaller meals reduce stomach stretch. Slower meals reduce accidental overeating. Waiting before lying down gives gravity time to help. Those changes work better than expected because they address the cause directly. But those changes only work if the eating habits actually change. On these medications, your body tells you it is full sooner. But eating fast can outrun that message. By the time the body registers that enough food has arrived, more has already gone in. That overshoot adds volume. More volume means more pressure. More pressure makes reflux easier to trigger. Slowing down is not just advice, it is the mechanism. The trigger is rarely one dramatic thing. It is not spicy food, coffee, or one bad meal. It is the repeated gap between reduced appetite and unchanged eating habits. These drugs reduce hunger. They do not physically stop intake. If someone keeps eating by habit, speed, or boredom, pressure can still build. That is when repeated reflux episodes start showing up. The stomach does not care about intention. It responds to volume, speed, and timing. That same gap also explains what happens when people decide to stop the medication. Stopping Wegovy or Zepbound may quiet the symptoms for a while, but that is not the same as fixing the problem. The reflux tendency was already there. The drug just made it easier to see. Stop the drug, and it goes quiet again. But the same habits, the same weak points, they are still there waiting. That does not mean every burning sensation deserves the same response. Mild burning tied to meals behaves differently from unpredictable burning that ignores meals. Those are not the same category. Burning that improves when meals get smaller and slower usually fits the reflux pattern. Burning that appears after lying down too soon also fits that pattern. Burning that stays random, frequent, or progressively worse deserves more caution. Pattern is where the evaluation starts. There are also clear warning signs. Trouble swallowing is different. Pain that wakes you from sleep is different. Chest pain with shortness of breath, fainting, or heavy pressure is different too. So is pain that spreads to the arm or jaw. That is not the moment for reflux theory. That is the moment to seek urgent evaluation. These warning signs are serious and uncommon in typical reflux. But when no red flags are present, pattern recognition is the right starting point. Most people watching this do not have red flags. They have habits. There is one pattern that keeps people stuck. People often try to remove heartburn while keeping the exact behavior that recreates it. They keep the large portions, they keep the fast pace, they keep lying down too soon. Then they conclude the drug is the problem. Sometimes the drug is part of the equation, but persistent symptoms are often fed by old habits. These choices no longer fit the new digestive setup. The trigger keeps getting rebuilt. There is also a middle group. If symptoms keep returning despite smaller meals and better timing, that still deserves a closer look. A pattern that persists through behavior changes is worth discussing with your doctor. Ask whether the symptom follows meals, speed, or lying down. Ask whether behavior changes reduce it. Ask whether any red flags are present. Heartburn on Wegovy or Zepbound is usually reflux. Slower digestion raises pressure, and old habits keep rebuilding the trigger. Match your eating to the way your body now works, and many cases improve. If the pattern breaks that rule, or red flags appear, get evaluated. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.